And good afternoon. Welcome to the COVID recovery series presented by Apollo Hospitals. Dr. Srinidhi Chidambaram here. I hope you're all doing well and staying safe. Lockdowns ease and the country unlocks. But these regulations are for us, not for the virus. It can cross borders, buildings, and nations and strike in various mutant forms anywhere, anytime. We need to accept this unfortunate truth and make sure that personally we continue to follow all the precautions and also take the COVID vaccine on time. And if you or your loved ones do get COVID-19, do not worry. With the right knowledge, you can have a very smooth recovery. And that is exactly what we are aiming to do with the Recover series that has been bringing to you week after week the most important and helpful information for those who have had COVID so that they can make a full recovery and regain their health and well-being. One of the most crucial aspects that help you to have a very quick and complication-free recovery from COVID-19 is your overall health status. Our experience with COVID over the last 1.5 years has shown that those who do not have comorbid conditions like diabetes or hypertension, heart disease, or at least have them in good control and management, and those who are not obese are the ones who are likely to have better outcomes and faster recovery, and they do not experience the post-COVID complications of inflammation or organ damage, which is what causes the mortality. Comorbid conditions, as you all know, include all the non-communicable diseases like diabetes or liver and kidney disease, heart disease, hypertension, cancers, and unfortunately, they already account for more than 65% of all deaths in our country. NCDs are very insidious, and we usually will never know just by symptoms that we have these conditions, except in the advanced stages. So early diagnosis is key to help you manage your condition and sometimes even reverse it. The only way for early detection is through systematic health checks, an annual health check where a series of tests and examinations are done to diagnose a host of diseases is then as vital as that mask or that social distancing or that vaccine or the sanitizing routine. Because when comorbid conditions are in control or even prevented, you have the best chance of recovering very well from COVID-19. To elaborate and guide us more on this, I'm very happy to welcome Dr. Rama Narasimhan, Senior Consultant, Internal Medicine, Apollo Hospitals, Chennai, with an experience of over 25 years and a very busy practice of seeing over 3,000 patients so far. She has worked for over 12 years in USA as a hospitalist, intensivist, and a primary care physician. She has practiced at many centers such as the Beth Israel Medical Center, Harvard University, the University of Massachusetts, USA, and the Kaiser Permanente, USA. She's currently an independent medical advisor of the US Consulate, Australian and Canadian High Commissions, and many multinational companies. She was also a resident in medical oncology in AIMS and has done her MD from Harvard University in the US and has also conducted research at Stanford University in the US. Hello, Dr. Rama, and welcome to our COVID Recover series. Thank you so much for joining us today. And do tell us, can regular health checks help us fight the COVID-19 infection better?
Thank you, Dr. Srinidhi. I've been watching all your series with a great deal of interest. And I must say you put in a lot of effort in taking the medical knowledge in a simple manner to the public. So really appreciate all the effort and the hard work that goes into it from your side, especially with your interest in public health and being a postgrad in that as well. So I think it makes a lot of sense. Yes, to answer your question, I do believe that, not to beat the same adage to death in terms of, pardon the pun, but, prevention is better than cure. So how we can combat any disease, whether it be COVID or otherwise, any acute illness, depends upon our internal well-being, our immunity, and our mental well-being as well. So I think there are three things that makes one feel well. And like you rightly said, the NCDs, the non-communicable disease burden, does impact our overall wellness. And therefore, in order to stay on the path of wellness and stay away from the path of illness or disease or unease at the lowest level, one of the ways to do that would be to keep an eye out on how our body is performing, whether it be in terms of diabetes or in terms of our blood parameters, whether we have enough hemoglobin in our body, things like that. And we have seen that patients who are diabetics do have a stormy or not a very smooth course with COVID, and also stay unwell for a lot longer as they recover from COVID. So in particular to COVID, because that seems to be the milieu right now, it's very important to stay well so that we can not fall sick with COVID. And if we do, we combat it much better and come out stronger and not weaker.
So in this, with this context, what would you advise people, or what are health checks all about? I mean, we start from the beginning. So what are they really? What kind of combination of tests are there, and who should take them really?
Right. So I think, I think to understand the concept of health checks, we need to realize that in India, it's a very open, free market wherein the onus is completely on the patient to come forwards for their wellness, as against a closed system, whether it be a publicly funded system like the NHS or Canadian or the Australian health system, or even if it was a profit sharing sort of a system like the United States, wherein you have insurance companies. In such systems, they understand that the final gain in medical economics happens only when the patient stays well, stays out of the hospital, and does not require to be on too many medications, which means that they insist that every person in that country goes for an annual physical exam, at which point the doctor has to advise them what tests would be age appropriate, risk stratify them, and suggest both a physical exam as well as certain blood tests. In India, however, we are a sort of an open system wherein the patient comes to the doctor only when they're unwell. And so there's a great deal of knowledge that needs to be disseminated to patients to understand that please don't go only when you're unwell. There's something called a well visit check. Just like you would take your babies because you love them so dearly, you want to take them to the pediatrician to make sure they're growing well, they're staying well, they're immunized. It's not any different for the adults. And ultimately, when you stay well, you don't fall prey to the long-term diseases. You don't have to be taking too many medications because interventions, simpler interventions will be made for you at an earlier stage of your disorder. So they might be even completely reversed. And the after effects of an undiagnosed or a missed illness will not be present. So you will not be dealing with really advanced cancer or heart disease due to diabetes. Completely preventable, treatable, reversible, curable causes can be converted. I think we're dealing with two problems here. A, trying to continue to focus on the importance of wellness and preventive health checks. And B, should we really also be doing that alongside with COVID? Because there's so much of worry for people to come to the hospital that they all stay away. So it becomes even more important now because you want to stay well to combat it. So it's very important to stay well now, more so than any other time when the whole world is under the grips of this pandemic that, like you rightly said at the outset, is continuing to change, evolve, and mutate, and has various variants. So I think it's a very important, crucial decision for everybody to make.
Yes, absolutely. But even at Apollo 2, of course, we must recall here that our chairman, Dr. Pratap C. Reddy, was the pioneer of health checks. So he was the one who introduced this whole concept to India. As you said, it was prevalent in other countries, but he was the one who brought it into the Indian system. But now we have so many health check options floating around us all the time. But even in Apollo itself, we have a variety of health checks, which is there in our brochure. So how does a person choose? I mean, like, what should a good health check program involve, and what is it age appropriate, or what kind of screening tests should one have at different age groups, so to speak?
Yeah, actually, I was going to say the same thing. I think one must really credit our chairman, Dr. P.C. Reddy, for
Yes.
trying to make something that is sort of user friendly, and I think that was the whole thought process behind his evolving or designing this package based health checks. um, because it's, to quote Steve Jobs, your service starts from the customer, not from us. So I think to make it simple and break it down to the customer, which is more in tune with their level of health literacy, he not only wanted to have these, have the ability for patients to take on something simple, but at least look after themselves, but also have a package. And that's how the packages evolved. So it's very specific to our country. And like you said yourself, he started it off in this manner. And like you say, everybody, including the government, has embraced it as a way to go forwards, because it makes it simpler for the patients to use, for human beings to use, for citizens to use. So it's a neat way of doing it, no doubt. But as you say, it's evolved and it's become so complex that it's a maze, which is right for me. So so obviously what would be right is, something that's age appropriate would be a good way to do. The way we do it in Apollo is slightly different. I think it's again because we try to take it back to the patient and see what's patient-centric or customer-centric or client-centric. The ideal situation would be that the patient comes to the doctor, discusses their health concerns, and the doctor channelizes them with a complete a clear picture of what's best fit for the patient, and so we do have packages of that nature as well. But sometimes, or most often, they don't want to be bothered with waiting and seeing the doctor. They would just want to get into a system, in which case we have multiple packages which are very easy in terms of how they're structured. But we do also have something that's designated towards the COVID situation for both recovery, post-COVID, and to assess how your health status is for somebody who's never been to a doctor, never checked their health status. How can you see if your immunity status is good enough, or you don't have any other risk factors that could make you more susceptible to COVID? So there are different choices out there, and there are mentors or people who can guide them with these choices. They're available both online or upon walking in. So I think the goal is really to try and keep it as simple as possible so more people can come forth.
Absolutely. These post-COVID programs seem to be like, I mean, it's just that we have introduced them in tune with the current need. Could you explain a bit more about these COVID-related health checks that we have?
So I think, like I said earlier on, I think the biggest fear for people is to come into the hospital. They just feel very challenged and very uncomfortable and scared to come in.
Especially the elderly, I think.
Absolutely, absolutely. And so I think the biggest step forwards from the Apollo team is to take the healthcare to the homes of the patients. So we have multiple ways of doing it in terms of the blood collection, video consults with the doctors. So various ways to keep the patients taken care of, and to seek medical attention, to get some input. And pharmacies also is in the loop in terms of delivering the medications. We are electronic. We do have a video consult platform. So various ways in which this can be taken to their homes rather than them coming out of their homes. Our personnel who go in are checked and screened, and they wear the full PPE. They are COVID negative testers. So we try our best to provide the care. In addition to that, if they do come in, they can still opt in for such tests as well for general screening. And the recovery packages are for those patients who've had COVID and are released. So we normally check the routine stuff because they might have been on a host of medications for that, and it might have impacted their sugar levels, or they would have had various levels of severity of COVID illness. And so following up and seeing what their oxygen levels are, or how their lungs have healed post-COVID. And also we provide like a pulmonologist review if they should need it. We also provide a dietitian review. So we give a lot of a very holistic 365-degree follow-up. One added bonus is also that we have healthcare mentors So we don't just do it as a one time and drop them off. We have the mentors calling them in every month, checking on them, reiterating some of the good practices that the doctor had set forth in their previous meeting, and make sure they're on track. Should the patient have any questions or concerns, they find us, they get the opinion, and they pass it on to the patient. So I think we're trying our very best to keep the continuity of care without expecting the patient to travel or come in, or we have taken the onus to look after them. Let's put it that way. Yeah.
Yes. Also, we were talking about people who are scared to go for their annual health checkup, or even for their regular consultations. So what happens, like, what should they be careful of if they kind of continue to skip their follow-up, or when they just neglect their annual check? What are the consequences?
That's a very vital point that you bring up, actually. I've had the privilege of having the opportunity to work both in the acute care setup with all these COVID patients who are very sick. So we see the wrath of the COVID completely manifest. And at the same time, I sit in the health check department and I see my regular outpatients as well as the preventive healthcare checks. And it tells us how there are two things along the same spectrum. And the tragedy is, out of this fear and the life having come to almost a standstill or staying in limbo for so long, there are many things that we wish they had come and somehow sought help, or at least contacted a doctor, and we could have triaged them to say, this one you can sit on and this one you need to bring yourself in. And not to scare our audiences, but there have been a few instances where breast CA was missed, and they did report something before the lockdown, and then they never went in because they were afraid to follow through with the test that was suggested. And a few months became almost a year and a little over, and what could have potentially been very salvageable turned out to be something that had spread way beyond what we anticipated. It would have been nice if there was, even at the outset, this whole thing was sort of like wrapped up, and we could follow up, and we could go ahead and capture the patient and tell them, even though it's dangerous, please, let's just have you get that mammogram, and we'll arrange it in such a way that you're not going to be exposed. We'll have a green belt, we'll have a green time for you to come in. All of the things that are available. But I think what's important is series like what you're doing now, so the public understands what does happen in situations like these, or unstable angina, where the patient keeps having this discomfort, chest discomfort, they're worried. Obviously, they think of COVID and they check their saturations, they get an X-ray, they think they find COVID-wise, they might even do an RT-PCR. What they don't realize is it's not all only COVID.
Yes.
And so when they do come in, they've, with a really bad MI, we realize on history that they've been actually struggling with this for a couple of months. Had they come in sooner, we could have actually fixed it. And now they've lost some muscle mass. Their contractility of the heart is irreversibly changed. And as physicians, it's very frustrating and saddening to see this happen. So it's important, therefore, I think that as an organization, we take the social responsibility to somehow reach out to patients, because we must have to look after them. Yeah.
And I think, we do have all the COVID safe protocols, and
Right.
And I think it's very important, particularly with, as I said, the elderly, who are, many of them are still, despite getting vaccinated, they are very paranoid about coming out and going for their, to give an example, even yesterday, a relative of mine in her 80s was so reluctant to come to the main hospital because, luckily it turned out to be just a vertigo. But if it had been another change in her ECG, I'm sure that, it would have been a real struggle to get them to, because there's so much of fear, maybe rightly so, but then it's really a difficult thing. But I think people should put the faith in the hospitals and their infection control protocols and the segregation, and not take that risk of not showing up at all. I think they do need to take that. It's very important. Yes. Could you tell us a little more about what kind of health checks should the elderly, that is at least the 60 plus, 70 plus, 80 plus, what kind of frequency and checks should they undergo so that they continue to remain in reasonably good health for the remaining years?
So based on the age, we normally have them get into senior citizen packages, primarily designed to look for age appropriate or age specific cancers that we like to screen for. So those packages are designed with that in mind. So for men, for instance, we check a PSA, which we don't normally check under the age of 40 or 50. So that would be something that they can look at. But for just about anybody, irrespective, I think just having an eye out on one's cholesterol. So the guidelines are very clear, like a USPS task force guidelines suggest based on age, the frequency at which we want to check for blood sugars, for cholesterol, for pap smears for women, mammograms at what age to start, for colonoscopies and such. We have the luxury of tweaking it a little bit in India because of, for two reasons. A, it's not just a big, large trust or a fund or an organization like an insurance company that's trying to have an equitable distribution of the money, so all the people who are paying into it can get the care. Here, the patient funds for it. So I think it's very important to tailor it and customize it for each individual's risk as well as needs and mental well-being. I mean, many times we have patients who have this worry of throat cancer, even though they're not smokers, and you delve deeper, you find they're worried because their father might have had throat cancer, or an uncle or a neighbor would have just been completely fine and they had anaplastic thyroid cancer. So, how do you send a patient back without addressing that to their satisfaction? Not to enable them in that anxiety path, but enough to understand that and tell them, look, you don't worry, you don't have it. So I think to that extent, we can tweak our testings to make sure the patients are completely mentally satisfied and at ease. The other packages that we do try and offer is even for adolescents, for children, for pediatric age group, it's important to have it screened. I mean, at age 2 and age 19, at least one time we check the cholesterol, and we're constantly looking at 40 plus age group because that's when we anticipate problems to occur. But the real prevention starts at age 2. So I think age 2 is pretty much well covered because all parents, whether they look after themselves or not, take their children to the doctor. Yeah, so 19, I would think, is the best age to inculcate good habits, good dietary, and almost all of my adolescent patients, they come with a relative who complains they don't eat well, they don't sleep well, they eat fast food, they're just not doing anything right. And one needs to understand the cultural milieu in the country is changing. And a lot of times there's not much of a dialogue between the child and the parents. So, I mean, a doctor needs to understand that and provide a lot more counseling than just diet and exercise to such patients. So it's important to actually target that audience so that you don't deal with the problem at 40. And that's why we find our non-communicable diseases upsetting and affecting individuals a lot earlier on than what we used to see when we first started practicing. So I think we should really start early. We should reach out to the population. We should be able to provide care that goes out to them. And like you say, tailor them at the very least, the very, very least, at least have your cholesterol, your sugar, your blood counts, your urine checked, and have appropriate healthy habits and healthy lifestyle dialogues, which is far more than just diet and exercise and sleep. There's lots more that we need to talk to them about in terms of their social pressures, in terms of their work pressures, in terms of their commute, in terms of how they sit in the office. A lot has to be done.
Absolutely. Is this what drove our chairman to reinvent a new initiative called Pro Health, which was launched recently? And what is that the one where the health mentors are there, and what is different between Pro Health and the usual health check packages, Doctor?
I think, like you said, I mean, it is really, I think for him, he's seen the full circle come through, where Initially, he started with wanting to take the healthcare to the patients. He innovated something. And now he finds that it's still, he's touched 1 billion lives, and there's 1 billion more to touch. And now, not everybody is reaching out to us. So how can we reach out to them? So I think that's the whole idea behind the Pro Health, is to take it to them and to keep them on the track. So we take the onus in keeping them on track, in staying in touch with them, in educating them, in following up with them, and not wait for them to come to us. So I think the health mentors is a big part, a big change, 365-degree change. And I think it's very unique to us. For a for-profit organization like us, investing in health mentors is a very big deal. And I can tell you for a fact that, having worked in both managed care organizations in the States as well as completely for-profit private practice as well, unless you're a managed care organization, investing in healthcare mentors is not going to make sense. Obviously, you need your patients to come back to you and spend the money. So for a corporate like Apollo to actually spend money to have health mentors so that you keep your patients healthy, tells you it's not working only for the profit of the organization. It's really looking out for your patients. So I really think it's a great step on his part and a great way to move forwards. And I do hope it's embraced by a lot of people. When we spend our money on personnel and our time and effort and logistics and IT to reach out to patients for free, so we make it right for them, I think that speaks volumes of what Apollo believes in.
That's a really wonderful thing to do. Before we go into the questions which our viewers are asking us live, I just want to end by asking you to tell our viewers regarding, the two very important pillars are the diet and the activity part. And, what would your simplest suggestion be to our viewers to maintain good health? What should they eat and what should they, because one likes to keep it simple, because it's really not the time to do elaborate diets and cooking and everything. So within one's constraints, what can one do?
I like it that you said it's not the time to be doing elaborate. I think all of us have watched. We've all.
And there's always Swiggy and Zomato and everything moving everywhere. So it is a temptation like never before as well.
Absolutely. So. And we've seen it all. We've seen people who were bored in the first lockdown become such professional cooks and whip up such fancy stuff. And like you say, the drone Swiggies and the Dunzos. And what I think the government intended to be as meals on wheels for people who are unable to make food for themselves has now become a sort of a eat out every single day, 3 times a week, because it's so easily and readily available. So that's one. And also it's sort of a little bit of a downer. Sometimes I feel the social inequity of it all, where we are busy preparing meals and serving it up. And then there's a section of the society that can barely afford 3 meals a day. So I would think that, in order to keep it really simple, go back to the old back to basics, where you never eat a full stomach. You eat only about 3/4 of your stomach. Never fill yourself up. And always balance your meal so you have a little bit of everything. Source it locally. Please don't go buy fancy stuff. We all like to, eat different. That's fine. But you don't have to necessarily make it a part of your regular routine to have whey protein or quinoa or exotic stuff. It's nice to taste it once in a while. Eat what the local people eat to the extent that it conforms with your religious and cultural sentiments. Because, obviously, if you don't want to eat meat and everybody in your area tends to eat meat, you might want to find alternatives that are protein-based and suit you. Because a lot, most often the locals have found a meal plan that works best for the climate, as well as what's locally sourced and seasonal, rather than having your imported New Zealand oranges and your strawberries from somewhere else. You can actually balance your diet very well with locally sourced food. And they're a lot easier on your gut, and genetically and racially, you probably can digest them better and will keep you far more regular. And I would always say less is more. I think the more we have excesses, it's difficult. watch your oil content. Also looking back, growing up, I did not find the amount of animal protein that's now easily available. I think there was a far more moderation at that time. For the amount of large quantities of animal protein require you to have large amounts of exercise and workout as well. And if you're not going to do that, then it simply becomes a question of wanting to satisfy your taste rather than requiring that nutrition. So I would think that, go back to the basics. I mean, if there were rules in most people about trying to fast one day or abstain from a certain type of food, I don't think that to me, it doesn't appear to be necessarily religious as much as trying to provide some sort of a discipline or a cookie cutter plan. Make it a no-brainer for you to just follow through. And they actually are just ways for you to even out your calorie intake and your protein intake for the whole month. Either you do it that way or you download an app. There are so many of them now which are good, what works for you, and input your food and your step count and stay active and eat less.
Absolutely. So now we'll just look at some of the questions.
Sure.
The first one is, what are antibodies, and why is it important for us to get this test done? What antibodies? I'm not sure. I assume the COVID antibody test.
Sounds like it, isn't it? So antibodies are body's immune system that releases a type of protein specific to any infection. So it's basically a measure of your immune system. However, a human body makes different kinds of immunities, and our medical science can measure antibody levels. We do not have the technique yet to measure other types of immunity status in patients. So, and also all types of diseases don't necessarily result in the body mounting an antibody type of immunity. They might also trigger a different type of immune response that we cannot measure by our machines that we currently have designed or have invented. COVID does have, and I'm assuming your question is for COVID, it does have, sort of trigger an antibody response. And therefore, when either a patient has had the COVID infection or has been immunized to COVID by the vaccination, many times, and not always, they will have an increase in the COVID antibody level. Now, there is a little bit of a disclaimer. So the antibody tends to, and we're learning along as we go along with this pandemic. So the antibody for certain diseases tends to peak and stay there and stays at that level for you to be protected from the disease forever, for almost lifelong. And some of them go up and down. So we're realizing with COVID that it tends to build up and drop after a while, which is why the question of should we have boosters for our vaccinations and such, which means that your immunity is not going to last forever. And I'll tell you why this is very important to understand. Similarly, we've also noticed that patients who've had really bad COVID, some of them do not all of them, but some of them do not have an antibody level at all. That does not mean that the body has not learned to fight it. We simply don't have the way to check the other kinds of immunities that the body has developed. Right. So it's not necessary that the person is now incapable of fighting COVID. Now, why is it important to understand this antibody level peaking and dropping down? Because it brings you back to what you should always be doing, wearing a mask when you're with other people and maintaining the social distance, and to follow good habits and good hygiene. Because all of these things in trying to teach our body to fight will work for a limited period of time, will work as long as there's a match between the virus and the immunity that you've developed, and will not work once the antibody and the immunity wanes off, and will not work if the virus gets smarter than us and we've not gotten the immunity to fight that off. So masking and social distance still remains very important, even if you're vaccinated or even if you've had the COVID disease itself.
Is there any program that you have to check the health status post-COVID?
So it depends upon how sick you were, how unwell you were. So obviously the ones who were very unwell in the ICU, ventilated, we do keep them on a close follow-up we might have also sent them out on medications for a little while longer to help with the healing of the lungs, to dissolve blood clots, so that we might have treated them specific to their severity of illness. So yes, those patients do follow up with us at a, we have a phased out program where they come in 2 weeks and then 1 month, and we might even image their lungs to see how they're coming along. Not always, but many times we do. And so yes, the program is tailored to how severe the COVID was. Fortunately, the number of people who actually just test positive for COVID but were asymptomatic or just mildly unwell don't really need to do very much other than just take good care of themselves, stay healthy, and exercise and do breathing exercises to keep their lungs healthy, and continue to follow good practices like masking and social distancing.
Of course, in the ProHealth program, I think you have a COVID.
Correct, the recovery
Yes,
package, yes. That is, so we tailor it based on how severely ill the patients were, because we do get patients from outside of Apollo and outside of Tamil Nadu as well. So they come in with their papers and their health history, and we advise them accordingly.
What if I get different results of 2 tests from 2 different laboratories? Which ones should I believe? This is in relation to health checks. I would think it's something to do with really choosing, where you do your test. I think it's something to do with that. I'm not very sure about it.
I think as a consumer, it's best to go to NABL accredited and NABL accredited labs or NABH accredited hospitals, which we are. We are also JCI approved. So we hold ourselves to very high standards of quality and concordance of readings. If you do find, the fact that you went to one place and did it all over again the second time tells you that you had a doubt to the first choice itself. So perhaps choose wisely and go to organizations that are approved by accredited standards of, industry.
Does a positive antibody test mean that I'm immune to COVID-19? I think you just explained this elaborately, but if you can just briefly.
Usually, yes, provided we are only exposed to the same kind of viral strain, but usually, yes. And even if it was a different strain, we are realizing that the immune response can protect us to a large extent. So yes.
I'm really confused on which ProHealth package to opt for. There is COVID-Fit, Core. So which one should I take?
So obviously somebody who's looked at it in detail is somebody who has a certain level of health literacy. So I really congratulate you on that you're going through the packages and looking at it. So that's a good thing. If you are confused, the best way to go about it would be to come in or have a virtual consultation with a doctor of your choice, and they can review your health history and your requirements and your current health status and guide you towards the right one. And if you're otherwise just completely was a mild case, go for the simplest package that looks at the basic tests, and then you can add on whatever you might want to add on. But when in doubt, always seek help from a qualified professional.
Yes, absolutely. I think with this, we come to the end of our questions. Thank you, Dr. Rama Narasimhan, for this wonderful and very enlightening session. And I do hope that our viewers would have been able to get good clarity on why they must do an annual health check and keep a tab on their health. And I do hope, viewers, that you will get your health check if you haven't done it already. And in any assistance that you need to get a health check done, we're always there and you can always contact us. As you know, Apollo Hospitals was the pioneer 37 years ago in doing the health checks and creating this particular initiative. But today we also have the state-of-the-art ProHealth initiative, which is a unique end-to-end personalized proactive health management program, as Dr. Rama said. And this brings together even risk analysis for whether you will be at risk for developing certain diseases, and the diagnostics and the physician evaluation are all part of it. So if you'd like to know more, don't hesitate to contact us at 1860-500-0707, or you could visit www.askapollo.com to book your check and to know more about this initiative. Viewers, please subscribe to our YouTube channel as well to get all the latest information on the various healthcare topics. And if you have more queries on this particular session, you can always post your comments on our Facebook page or put them on the Facebook Messenger. So with this, we come to the end of our COVID Recover series. We have tried to cover all aspects of COVID care, COVID recovery, and you can find all the links on our Apollo Hospitals YouTube channel. We thank you for participating and making this series a resounding success. And we thank all the doctors who also spent time on this effort and spent a lot of time in educating and spreading this much needed awareness. So viewers, goodbye for now and remain safe. Don't forget to follow the 5 W's of COVID-19 prevention. And you know what they are. What is the SMS that we have been talking about in each session, which is the sanitizing, wearing the mask and social distancing, plus the vaccine, of course. When? You have to do it every time. Where? Everywhere. Who has to do it? Everybody has to do it. Despite vaccination status, you still have to do it. And why? To stay protected from COVID-19 and keep your family and loved ones safe as well. With best wishes to all of you to remain safe and be very, very healthy and well. Thank you very much. This is Dr. Srinidhi Chidambaram. Thank you and namaste.